Welcome back from the break. From the moment coronavirus reached the United States, its impacts have been much more severe for communities of color. The CDC reports that compared to white non-Hispanic Americans, Hispanic and Latinx Americans are 2.8 times more likely to contract the virus and 4.6 times more likely to require hospitalization. For Black Americans, the rates of infection are 2.6 times higher, hospitalization is 4.7 times greater, and the death rate 2.1 times that of white Americans. Unfortunately, disinformation about and distrust in our medical system plays a significant role in these outcomes. Last Monday, I had the pleasure of speaking with Dr. Lena Wen, an emergency physician and visiting professor of health policy and management at the George Washington University Milken Institute School of Public Health. Dr. Wen previously served as the health commissioner for the city of Baltimore, where she led the nation's oldest continuously operating health department to fight the opioid epidemic, improve maternal and child health, and treat violence and racism as public health issues. Dr. Wen has been a leading voice in the call for science-based policies and practices during the coronavirus pandemic. And on Monday, we spoke at length about the impacts of COVID-19 on communities of color in the US. Dr. Wen, thank you so much for joining us. I'd like to start off by asking you about the sort of data that we're seeing in terms of disparities in COVID-19 infection rates and outcomes for people of color around the United States.
Yeah, first of all, Rebecca, I'm glad to join you, and thank you for focusing on this really critical topic, because we know that this disease, COVID-19, is not affecting people equally, that communities of color are bearing the brunt of this pandemic, and in fact, that this pandemic has unmasked many underlying health disparities that we've known for a long time have existed, but are really being brought out in the wake of this pandemic. And so we have seen that African Americans, Latino Americans, Native Americans, Pacific Islanders, those again who already bear the brunt of so many other health disparities, are experiencing the worst outcomes. They have disproportionately many times the rate of hospitalizations, of deaths, tragically, due to COVID-19. And when we look at the reasons as to why, it's several-fold. First, it is that we know that social distancing is a privilege that not everyone has access to. And so people of color tend to be essential workers who, from the very beginning of the outbreak, have not had the opportunity to practice physical distancing. In addition, we also know that people of color tend to live in crowded, multi-generational housing where even basic precautions like isolation and quarantine are difficult. And then you also look at who has already underlying health conditions that will then make people more susceptible to adverse outcomes from COVID-19. You know, you look at a city like mine here in Baltimore, where 1 in 3 African Americans live in a food desert compared to 1 in 12 whites. Well, is it any surprise then that African Americans also disproportionately have diabetes, heart disease, obesity, these conditions that then also predispose to severe outcomes because of COVID-19? All of this is a reminder then that it's not the virus in this case that is doing the discriminating. It is our health systems, it is the conditions in which people live, these social determinants, that we know influence health in many ways, but certainly influence the health outcomes when it comes to COVID-19. And very tragically, perhaps the most tragically of all, the same trends that we see in adults, they're mirrored in children. 3/4 of all the deaths that have occurred among children due to COVID-19 are among the same populations. They are in Black and brown children.
Do you get the sense, looking at the data and looking at the trends on the ground, that we're improving over time, over the course of the pandemic itself? Have these trends of the impacts of communities of color actually changed over the course of the last 7 months, or are we simply watching these be recapitulated over time?
It's a really good question and one that I don't have the answer to. And that's because we have been missing data all along in the pandemic. From the very beginning, we have a big problem with data. And maybe in the beginning you could understand because we were just getting started. But we are still missing key data points when it comes to, for example, who is impacted. Who are the individuals who have increased rates of hospitalizations and deaths? Different states report the data in different ways, making it a difficult comparison. Also, you have different groups that may be classified differently. So, for example, some states may report on Asian Americans, others would separate Pacific Islanders from AAPIs in general. And so we have a big issue with data collection overall. One hopes that the disparities are improving over time, but based on the limited data that we have, it does not look like we're getting any better.
Do you have any particular concerns about how information, and particularly misinformation or even disinformation, about the virus itself are being received within communities of color and are ultimately impacting these communities?
Yeah, another good question. I would say that disinformation in general around COVID-19 has been a big problem. It's manifest in different ways. So first, there is just frank disinformation. Disinformation about how we've all heard these that COVID-19 isn't real. Even the data around who is dying from COVID-19. There was a CDC report that was put out looking at the conditions that are reported. And even that information has been misinterpreted in so many different ways because we know that death certificates may not contain just one diagnosis. Somebody may be dying from COVID-19, but also have respiratory failure as a cause of their death, or they may have an underlying condition in addition to having COVID-19. Maybe they have heart disease and COVID-19, but that doesn't mean that this person did not die because of coronavirus. It's kind of like saying somebody who died from a car accident but also had cancer, that somehow they didn't die from this car accident because they also happen to have cancer. I mean, even something like that has gotten misinterpreted in so many different ways. And I think it really speaks to also what's gone wrong in this response, that there has been mixed messaging, that instead of having public health lead in the response, so often we've seen public health experts and scientists, frankly, being pushed under the bus, that the message between public health officials and elected officials has differed, and that's led to a lot of confusion. Then I think you also have a different problem in this case as well, which is that at baseline, you have communities that have had distrust in things like vaccines. There are, for example, vaccine skeptics who may be anti-science at baseline. Then you add on top of that because of the of various political interference and fears of political pressure, that also has really interfered with people's trust in science. And now you have a whole group of people who are distrusting the process of regulatory approval, not because they distrust science, but because they fear political pressure and manipulation. And then you have a third group that has had historical distrust in the scientific and medical community for good reasons, because these are the groups we're talking about: Black Americans, Native Americans, and other groups that have had legacies of being experimented on, of unethical, illegal experimentation. And now we're asking these same groups potentially to also be involved in vaccine trials, because we do want to include everyone in vaccine trials. But I think it really is important for us to do public outreach and education. And in addition, to also make sure that when these same therapeutics and vaccines come out, that the distribution is such that the same communities that are the most impacted by COVID-19 also receive these vaccines and therapeutics first. Because otherwise we will perpetuate this concept that somehow we are experimenting on Black and brown bodies for the benefit of white and privileged individuals. And so this is such a complicated, multifaceted issue, but we have to be attentive to it and recognize that disinformation is rampant, that many communities already have underlying distrust, and that we have to do our best to make sure that science leads this process and that we're overcoming the mixed messaging that's been hampering our response all along.
So I'd like to talk a little bit more about these potential solutions. And thinking particularly, you've just described a very complex problem here. We have historical experiences, we have contemporary political actions and motives that are creating an environment of great distrust. If you were still a public health commissioner, whether it were Baltimore or really anywhere around the United States, what are some concrete things that you would want to put in place in this moment right now to try and help solve these problems, to try and help deal with this this great complexity?
Well, I appreciate the question because I think so often we admire the problem and we don't get to the solution. And there are actually tangible solutions, in particular when it comes to reducing these disproportionate impact of COVID-19 on communities of color. I had the opportunity to testify in front of Congress twice in the last several months, specifically about these solutions, urging Congress. I mean, you talked about what we should be doing as public health officials, which I think actually looking at my counterparts across the country, local health officials, state health directors have been doing their best under extraordinary circumstances. These health departments are already extremely resource limited. They are fighting disinformation every day. They are doing so much with extremely few resources, while also trying to do everything else, because health departments are also the safety net for their communities. And they're also trying to work on food access and on assisting with individuals experiencing homelessness. I mean, they're trying to address the opioid epidemic and so many other factors while they're doing this too. So I think actually they are doing as well as they can under these conditions. But if I may reframe your question to say, what can we all do? As in, what is the role of Congress? What is the role of all of our elected officials who must all answer this charge? There are actually specific tangible solutions. First, we talked about the issue of data. Let's make the data known on the demographic breakdown when it comes to hospitalizations, to deaths from COVID-19, but also to testing. One really specific characteristic that we should be measuring is around test positivity. We know that the test positivity should be below 5%. If it's above 5%, it means that we're not testing nearly enough. We should be making test positivity rates available across demographics and across and through specific zip codes and on the community-wide level. What I mean is that you may have a test positivity in a state that's 5% or even 3%, and it looks like it's going the right direction. But if we also have test positivity, let's say for the Latino American community, that finds that the test positivity in this group is at 20%, we know that we need much more specific targeting to this particular group. Or if we know that a particular zip code is testing at 20% or 30%, and the rest of the state looks fine, but this zip code really needs specific resources. And so that allows us to target testing, for example, having mobile testing or partnering with churches and community groups so that we are targeting the resources to those communities that need it the most and not just addressing the population as a whole. That's a key principle of equity. In addition, worker protections. We know that essential workers tend to be people of color, individuals working in nursing homes who still don't have the right amount of PPE, individuals who are home health workers, who are in meatpacking plants. Instituting strict worker protections on the federal level, but also on the state and local level, enforcing it on these levels is going to be really important for reducing the disproportionate impact on communities of color as well. We also need to look at these other social determinants. We know that housing, for example, is also something that very much influences health, and food insecurity very much does too. And so if we are telling our patients to isolate if they are ill or quarantine if they're exposed, but somebody lives in a house where they're literally unable to do that, then what can we as society help to provide them with the resources to do so? Or if people are afraid of losing their jobs if they test positive or are exposed, what kind of protections can we also put into place to help with that? Finally, I want to touch upon this issue of our educational divide and the educational disparities that we are seeing in this time. It is such a complex issue to think about reopening schools. And I know that many schools have reopened, potentially in a way that may contribute to outbreaks among the students, the staff, teachers, the families, also the communities around them. At the same time, we also know that keeping schools closed is going to further that educational divide and contribute to this COVID slide that we're seeing all across the country for our most vulnerable children. And so the key here is for us as society to reduce the level of community spread as much as we can, to invest resources into our schools, not just into wealthy private schools, but to all schools, and in particular to schools that already lack the resources for their students, so that we can, as a society, prioritize schools as the most essential to help our children who are most in need.
Dr. Wen, could you tell me a bit more about some of your experiences talking to people on the ground, whether it's healthcare workers, patients, members of the communities themselves that are being affected? What have you been hearing from people on the ground? How are they reacting? And what would you say that they need to hear from us going forward?
Well, I mean, I think I'm hearing from patients, from community members that they want to do the right thing. I mean, I think people are recognizing in the areas where I live, at least, and the communities that I speak to, that they absolutely understand that COVID-19 is a pandemic, that it's something that is affecting each of us. And I think there is a great deal of frustration. Of course, quarantine fatigue is something that's very real. But I think there is a great deal of frustration that people can be doing all the right things, but then there is this mixed messaging, this confused messaging that's coming from our elected leaders, that's making the sacrifices that people are making every day go in vain. And that's very difficult for people to hear and to conceptualize, because people are giving up so much. I mean, people are not seeing their grandchildren. Their older adults are not able to safely gather in senior centers that have been their lifeline. Kids have not been able to go to school. Individuals have lost their livelihoods because of this pandemic. I'm hearing that we gave up so much and had this opportunity early on to contain this pandemic, but we haven't. And now we're continuing to sacrifice so much and lives continue to be lost. So I think that's one theme. Another theme is that of quarantine fatigue, which is that we can't be isolated for the foreseeable future. And it is important for us to figure out which risks we're willing to continue to take on and which are the risks that we really need to cut down on, understanding that we need to figure out how to live with this virus. And one of the trends that we're seeing is that many new infections are not so much due to the congregate settings or to formal settings, but rather to informal settings, that people are getting infected through gatherings with their loved ones, through extended family and friends. And so I think one message that's really important for all of us to keep on distributing is the need for continuing to be on our guard, that up to 50% of the spread is from individuals who don't have symptoms. And there is a level of magical thinking that I think many of us have, that our loved ones don't have coronavirus because we know them, we love our loved ones, but that is somehow strangers who are carrying this. But I think it's truly critical for us to keep in mind that if we are doing all these things to keep kids physically distanced at school, they're wearing masks, but if they're only going to be coming together for play dates or birthday celebrations afterwards and not going to be abiding by these restrictions, that we're still going to have outbreaks. And in fact, these outbreaks are going to lead to schools being closed for longer. By the same token, if we're doing everything we can at grocery stores and at work, but we're still getting people together for dinner parties indoors, that's also going to be eliminating all the good work that we're doing. And so remember to use an abundance of caution. Think about all those things that are the most important to you. And remember that mask wearing, gathering outdoors rather than indoors, eliminating or avoiding crowds. These are all the things that we can do in order to protect ourselves and our loved ones. And it also allows us to get as much back to normal and to not be isolated as we can.
Dr. Lena Wen, thank you so much for taking the time to speak with us today. Thank you for all of the work that you're doing, and please be safe and be well.
Thank you very much.
Joining us now to continue our discussion, we have Dr. Amanda Castell, who is a tenured professor in the Department of Epidemiology at George Washington University. Dr. Castell is a physician and CDC-trained epidemiologist whose research focuses on HIV and related infectious diseases. She's worked domestically and internationally on HIV/AIDS surveillance, prevention, care, and treatment. Since the start of COVID-19 pandemic, she's been providing support to local health departments and serving as part of the public health team, leading GW's reopening efforts. Dr. Castell, thank you so much for joining us.
Good morning, and thank you for having me, Dr. Trumbull.
So I'd like to begin our conversation by asking you about one of Dr. Wen's remarks. She noted that African American, Native American, and other communities of color often feel significant distrust towards medical and public health institutions, largely because of a history of illegal and unethical experimentation. Could you tell us a bit more about this and about how this history might be shaping coronavirus outcomes in the US now?
Certainly. So what Dr. Wen said rings so true. We've seen histories of these types of unethical research and experimentation among communities of color. If you think back to the Native Americans, it really started with the colonization of the United States, bringing infectious diseases that these populations had never seen before, systematically stripping Native Americans of their rights, their land, their heritage. And even, in the 1990s, we've seen research that's been done. There was this diabetes project done among the Abusapai Indian Native American tribe, where these individuals agreed to share information and to donate blood for a research study that was supposed to be focused on diabetes mellitus, only to then find out that the information and their blood was being used for other purposes. And so examples such as these are unfortunately pervasive throughout our culture. In the African American community, the Tuskegee syphilis experiment still is in the back of many people's minds. This was a study that took place for decades among African American men who were being followed for syphilis infections. And even though in the late 1940s, syphilis treatment was available, these men were not able to access this treatment. And the study went on until 1972. So all of these are examples where, because of the way that these communities have been treated, there is certainly, understandably, skepticism, mistrust. People are scared in these communities. And unfortunately, COVID didn't create the situation. COVID really has just reminded us of this unhealed wounds and how, yet another pandemic, another situation such as this has really impacted these communities. As Dr. Wen mentioned, we've seen that because of these longstanding historical inequities and the structural racism, that these communities of color are more at risk. They have a higher prevalence of comorbid conditions. They're living in crowded housing. They constitute the majority of essential workers. And we've seen now from the data that those are all risk factors for worse outcomes. That's why we're seeing these high rates of mortality among these communities of color. So unfortunately, this is not something new to those of us living in these communities. It just continues to show how much inequity there is, really.
Really revealing the long-standing historical, but now very clear contemporary inequities, bringing them much more clearly to light, it seems. I'd like to turn now to our next panelist and bring Shay Akiwowo, apologies, into our conversation. Shay is the founder and executive director of Glitch, a charity dedicated to ending online abuse and championing digital citizenship. Glitch was founded very shortly after Ms. Akiwowo, then a politician in London, faced really horrendous online abuse. Ms. Akiwowo travels the globe now, developing practical solutions to protect our online public spaces from hate and abuse, and to inform people about how best to be digital citizens. She's an Amnesty International human rights defender, and in 2019, she was named the UK Digital Leader of the Year. We're also very pleased to announce that Shea Akiwowo is joining IDDP as this year's Knight Fellow. Ms. Akiwowo, we're delighted to have you here and so happy to welcome you to the IDDP family.
Thanks. Now I can officially tell people. I've been keeping it quiet for so long. Now I know how people on The Voice or X Factor feel when they can't tell people if they've won or not, or if they're in the finals. Yeah, really part of the IDPP family.
We're really, really happy to have you join us. I'd like to, for the first question I want to put to you, I want to focus just a little bit on the theme of today. Our conference is really premised on the notion that COVID-19 has forced our lives, including our political lives, online really like never before. Yet, as Dr. Wen noted in the tape we rolled at the beginning, this very shift is itself a privilege, and it's a privilege not afforded to people of color in the same ways that it is to white people. At the same time, as your own personal experience illustrates, when people of color do engage in politics online, they face abuse and harassment really to disproportionate levels. Can you tell us a bit more about this and about your work in this area?
Yeah, great. I'm really excited to be part of this panel. Normally I have to tell people what digital citizenship is. The fact that it's on the name of this panel means we can just cut straight to the solution. So I'm excited about this. I'm really glad to be on a panel with Amanda too. So you're right to set context that before COVID-19, there was already an issue around online abuse and how it disproportionately affects women and marginalized communities. We already knew before COVID that Black women in the UK and in different parts of Europe and the global South were 84% more likely to be mentioned in problematic and abusive tweets than white women. We knew that disability hate crime online was going through the roof. We knew that LGBTQI+ communities were also facing harassment online too. And then you had lockdown. And for us in the UK, that happened around late March. And you saw our internet kind of regulator or not really regulator, our internet kind of moderator said that we had been spending unprecedented amount of time online. And for us, that rang alarm bells around how we've now increased the risk and likelihood for these very communities to be disproportionately affected. Because at the same time, we have a deficit in education around digital citizenship, around online efficacy, around what to do when somebody is facing abuse online. So you have that, you have the COVID-19, you have already abuse online, the lack of diversity, and what you saw was basically an explosion of online abuse where women who completed our report, The Ripple Effect of the Pandemic Online, almost 46% of women surveyed said they received some form of online abuse or harassment. And then when you look at Black women and minoritized people of color, Black women and minoritized people and non-binary people, that went up to 50%. So this was just a small UK charity in the UK trying to find some insights that were able to show that there's this compounding volcano basically erupting online that we're not listening to. And it's really important as well to say this is also then dovetailed with Black Lives Matter, resurging online, and that being the main way that most communities could express their opinions online. And they were facing horrific organized trolling, the kind of dogpiling, cross-platform harassment, the wrecking of hashtags and movements, the relentless trolling of activists who were trying to speak out, people who were trying to fundraise. There was intentional backlash happening, and that was some ways that communities were engaging in politics that really meant a lot to them as well. So you had a lot of this happening over the summer, and still, we're coming through in some ways here in the UK and Europe on the other side, although there is now conversation about another lockdown with no analysis around around how we're going to learn from this, how we're going to have some kind of digital citizenship education framework, how are we going to get people to understand that as we're advocating for digital rights, there's also just a responsibility. How are we also going to be really clear that not everybody can access the online space in the same way? So you've got a digital divide, and that affects both in terms of gender and race. But even when you're accessing the online spaces and platforms, some people are just already set up to be more at harm. So I remember when I changed my display picture on Twitter from having my having my weave, my straight weave or my straight hair, I can't remember, to embracing my Afro hair, and that sparking abuse. That wasn't me tweeting anything. That wasn't me being, as like people would say, provocative, nothing at all. It was just me being unapologetically Black with my Afro hair sparked abuse. And I think that's also really important when we're talking about digital citizenship and about how communities should be able to thrive and flourish online. And that's not what's happening at the moment. And the danger is, if we want to make progress on global goals, on equality, on human rights in our politics, we won't make any progress until we tackle this glitch.
So I think that's a really powerful personal anecdote that you've just shared with us, really helping to illustrate what is an extreme and much larger problem for many people. I'd like the three of us to talk together just a little bit about some more kind of recent history, let's say. Dr. Costello, you reflected for us on kind of long-term perspectives within the US and feelings of distrust in communities of color for the medical community. But I wonder if we might look to even more recent trends. And for example, to the HIV/AIDS pandemic. Dr. Costello, this is your primary area of research. Are you seeing major differences between the way communities of color are being impacted, particularly given that social media is so prevalent now in the experience of the COVID-19 pandemic compared to the 80s and 90s when the HIV pandemic was really at its height?
Yeah, it's a great question. And unfortunately, what I'm seeing is many similarities, and many of us that work in HIV have reflected on this. This is a new virus. We didn't necessarily know how it was being transmitted. We didn't know what the viral origins were. We didn't know who was at risk. So all of these are things that we grappled with the HIV epidemic. Testing, a huge issue, right? How did we get testing to people who were perhaps exposed to HIV? We're seeing the same things here with COVID-19. And so, it's frustrating. We've seen with HIV, there's a long-standing history of misinformation and disinformation. We've had people domestically. There was a writer, Christine Maggiore, who was one of the first HIV denialists. She herself was infected with the virus. She had some tests that were positive, some that were negative, again, reflective of our steep learning curve when it came to the HIV pandemic. And, she was very vocal and actually worked with ACT UP, which is a very well-known grassroots community-based organization that early on in the pandemic actually was a part of this denialist, kind of propagation of misinformation. And now, of course, is one of the kind of leading organizations in helping us understand HIV in certain communities. We saw leadership that doubted the role between HIV and AIDS. The former president of South Africa, Thabo Mbeki, was famous for saying at the AIDS conference that HIV was not the virus that caused AIDS. And, we had to have the Durban Declaration where thousands of researchers and scientists said, we have to dispel this myth. This is not true. We even saw propaganda, conspiracy theories from Russian KGB. There was this Operation Denver that, actually tried to say that HIV and AIDS were part of CIA warfare. So we've seen this before. This is not new to those of us living in the HIV field, unfortunately. I think distinctly what's different is that was in the 1980s. And here we are, right, in the 21st century, where social media is pervasive. And we have never experienced an epidemic or a pandemic where there's such a high prevalence of social media and so much access, which is good in some ways, but can be, a challenge in others. I mean, for those of us in the scientific field, even open access publishing, the flood of information and how you read through it and how you process what's right and what's not, and how you make sense of something that's all new is very challenging for us. And so when it gets put out there on social media, having to filter through what's true and what's not becomes even more complicated. And with increased social distancing as well, right? With social distancing being a recommendation, people are not getting information by word of mouth as much. They're relying more so on the media and social media to get their information. I mean, we've done research in the African American community in DC. 70% of African Americans get their information through social media. When we talk to young kids, 13 to 24-year-olds, 30% of them tell us that they rely on social media for their health information. So we really need to make sure that the information that's out there is accurate and understandable, and it's not complicated by outside influences. And that, as Dr. Wen said, that really the science is leading the information that gets out there and gets shared with individuals.
You've spent quite a bit of time really on the ground, talking to people, working directly with communities all around the world on these issues. You're a bit of a shoe leather epidemiologist. As you've worked, your work was focused more on HIV and AIDS. How do you compare what you're hearing from people working in that field, working in that area on the ground, to what you're hearing from people now, where they're getting their information, and how it's potentially impacting their reactions to that?
Yeah, so during the COVID response, I actually, as you said, I'm trained at CDC. I've done outbreak investigations before, and when the pandemic started, I really jumped in and volunteered my my time and my expertise to helping with local health department response. And so, I say I was fortunate enough to actually help with, dozens, if not hundreds of case investigations. And speaking to people who were getting infected with COVID was unfortunately very similar to people living with HIV and talking to them as well. When you say you're calling from the health department, they want verification. Are you really calling from the government, or is this a hoax? And, given the political environment that we're living in and the disproportionate impact on people of color, there were often questions about, how is this information going to be used? People were reticent to speak to us if they were potentially, immigrants or undocumented, and worried how this information might affect that status. And we had to reassure them that it wouldn't. People initially, I would say, were really open to speaking with us. This was new. We were learning from their experiences. And they also, had lots of questions for us. Again, very similar to the HIV epidemic. But I would say, as we've gotten more into this pandemic, we're 7 months in. I'm not doing those investigations myself as much, but I do recall feeling like at the end of, the summer months, that people were tired, they were skeptical, they didn't necessarily want to share as openly the information about COVID, about their contacts. They were worried about their jobs. So these are real issues that we saw, and that I personally have observed in speaking to people about COVID. So this is very challenging, where we really need to make sure that, when we do have information to dispel and correct myths and misunderstandings, that we can do that. But I also think it's a challenge for us to be able to say, you know what, this is a new virus and we actually don't have all of the answers. And to hopefully help people understand that as soon as we do have those answers, we would share them with the general public. So it's definitely been a challenge dispelling all of the hoaxes, around this is a virus that was started through 5G, that certain populations have immunity to the virus. We know that this is not true. and also dispelling some of the racism and xenophobia around the virus also has been really, really important.
Indeed. Speaking of racism and xenophobia related to around the virus, Ms. Akiwowo, I wonder if you could give us a bit more of some perspective from your research, from your own experiences, about how the notion of disinformation has sort of changed over time and how it's been applied to different communities.
Yeah, I remember speaking with Sandra Pepper, the director of National Democratic Institute, a couple of years ago, on a Human Rights Council panel, and this is when this was the first time we heard the word fake news. And having a conversation, she's a Black Brit, but living in America, having a conversation around the term fake news and why it was in quotation marks, what it meant and stuff. And by the end of the conversation, we both felt that the reason why fake news just didn't feel like it reflected or explains our situation and what we were feeling for women in politics, particularly online, was because it was a term that was essentially created and used to exclude everybody but white people. It was a new term to explain the issues that liberals were facing, such as Hillary Clinton, the president of the United States at the time, and also some politicians in the UK. But for so long, communities such as Black communities in the UK and particularly African communities in the UK were subjected to fake news or disinformation or misinformation. But then it was called gossip. Then it was called stereotyping. Then it was called scapegoating. And it felt like this terminology wasn't to try and capture the experience and behavior, but was trying to distance itself from, no, what happens to you is true, but what's happening to us is actually more impactful. Disinformation only became a problem for democracy when it started to impact white communities. But disinformation had been putting African Americans off from voting, Black communities from engaging in politics, from engaging in society, from answering the phones, from opening the front doors. Disinformation and stereotyping and scapegoating has shaped so many communities, particularly in East London, where I was fortunate to be a councillor and represent for 4 years. And then all of a sudden, because it affected certain communities and their likelihood of getting elected, because it was in the interest of big power players and numbers here and businesses, then we started to care about it. And I think if we're truly going to want to grapple disinformation, we have to care about disinformation for everybody, because we're still seeing a hierarchy in disinformation. When it comes to the COVID crisis and disinformation, we only see it where it impacts certain communities. When disinformation, as was mentioned by Amanda, when disinformation was being spread by some Black leaders in the UK, no one called it out. No one made any interventions. No one did any kind of countering campaigns. And then we found out a couple months later that Black communities were 4 times more likely to die from COVID. But prior to that, disinformation was being spread by some online Black leaders, some by social media influencers who have a very nationalistic idea, saying that it was a man-made disease. It's a way to put a chip in you, etc. All the things that I'm sure Amanda's heard before about other pandemics or outbreaks. No one seemed to want to grapple this affecting us, yet we were 4 times more likely to die. And this was something we were seeing online. And because everyone was online, more so now, during lockdown, people were reading that and believing it. But yet when it started to affect the north of England and other communities, that's when we had to start tackling disinformation. Or more broadly, if we take a more macro level, the likes of Jack Dorsey and to some extent Mark Zuckerberg only started caring about disinformation when it became an issue around COVID. But when it was affecting women in politics, when it was death threats, it took the president of the United States to get COVID and for Twitter to then release a statement to clarify its rules around wishing people death. But when it had been happening to Black people, African Americans, disabled people, LGBT communities who were sent threatening letters online and then followed offline, where attacks were carried out offline, there was no announcement made there. And so there is such a disparity in how we talk about disinformation, who we really mean, who we're really centering, whose lived experience we really care about.
You mentioned your experience as a counselor in East London. Of course, today's panel, today's conference is really framed around the 2020 US elections. But given your political experience in the UK and really around the world, your work is truly international. I wonder if you could share with our audience some thoughts about how the US experience as an observer of the US really compares to that that you experience in the UK and elsewhere.
Parts of me is jealous, if I can be honest. The professions that I'm constantly open to seeing in the academia world. You know, like, Amanda, what you do is amazing, and I'm like 80% sure that your role doesn't exist here, and if it does, it's so underfunded. There was a study that came out last year about how academia as a whole, only Black women make up something like 10 of them. So there is I get sometimes really jealous around the kind of things that Americans are able to investigate and look at and apply social work and human rights to tech and AI. Yes, we have the kind of Oxford Institute and you know, all sorts, but again, we know what it's like with Oxbridge and people getting to go to those universities and access and all of this stuff. So a part of me is jealous around how there is that openness to investigate. That, I mean, I'm sure it's hard to fundraise, but there is that willingness for philanthropists to really understand the landscape, which is really missing here. It's really missing in the UK and in Europe. The second thing is community organizing. I think it's really clear, like, when it comes to it, like when it's like literally a matter of life or death, the structure and the accountability systems that exist in America, I really, really admire and appreciate. In feminist movements, in anti-racist movements, in LGBT movements, it's something that I think here in the UK we need. And then thirdly, I think what we don't have enough of is cross-party support for candidates in going for office. So you've got like She Can Run, you've got, you know, really amazing umbrella organizations or non-partisan organizations that are really up for improving the representation of women. We have that in the UK, but in very small pockets and severely underfunded. So there is still a kind of lag in understanding the importance of gender representation, and then obviously intersectionality of that, and then also the community organizing to get leaders ready to take up the official office if that's where they want to go.
So thinking about community organizing and potential for actual change, I wonder what the two of you think needs to, what you would like to see moving forward in terms of broad-based solutions. Dr. Castell, maybe starting with you, thinking about this from a public health perspective.
Yeah, no, absolutely. I think, you know, we are now, 7 months into this pandemic, and we're seeing already the second wave. You know, certainly, I'm sure seeing it in Europe, right? There are new lockdowns occurring. And then we're also preparing for vaccines, right? And the rollout of vaccines. And we know that these communities of color are already skeptical about vaccines. There's vaccine hesitancy. There are low rates of vaccination, at least in the United States, pretty much across the board. And so couple that with all of the mistrust, the disinformation, the politicalization of the pandemic, that's going to be a huge hurdle to overcome. So I think it's really important that we start thinking about the strategies that we can use to keep people safe, keep them thinking about the preventive measures that we need to take to get us through this pandemic, but also thinking about vaccine hesitancy. So a couple of things come to mind. First and foremost, obviously, is we need to get to the root cause of this, right? We need to dismantle this whole notion of institutionalized racism and these structural inequities. I mean, and that's obviously a large initiative and effort that has to take place, and you know, it's going to take years to do that. I would echo what Dr. Wen said about the data. We absolutely need to be evidence-based in our approaches here so that we can figure out where we can really focus our resources and have an impact on the communities that are most in need. And that includes making sure that we get vaccine to those individuals who are most vulnerable and most at risk. Community engagement is really the foundation of all of this, right? So whether it's grassroots, knocking on doors, increasing health literacy about COVID, or whether it's having individuals at the table with the drug companies and thinking about vaccine distribution and how to do that in an equitable manner, that's where we really need to have that community engagement. As a researcher, for me, there are ways that you can do this, like community-based participatory research. So taking the time to understand the cultural context within which you're going to be working with communities, and what are the challenges and barriers, and kind of what are the baseline, what's the baseline understanding or fears of the communities in which you're going to be working is really important. But making sure that those individuals are at the table from the beginning to the end. And then another and kind of last point, which I want to highlight that's worked really well in the HIV response, is this idea of key opinion leaders, right? So if you can figure out who is a leader in that particular community, where do people go for their information? Now in social media, I think we call them influencers, right? So figuring out who those influencers are, who can get real information and real data out to communities, I think will also help to kind of mitigate the spread of the disinformation and the misinformation. And for me personally, as soon as I see anything that just doesn't sound right, I think we have to think about how do we stop that from propagating, stop that information sharing that's wrong in its tracks and correct it with factual information and evidence so that you can kind of right that wrong and use social media for its good, and don't let it be the detriment of society and thinking about how this pandemic can play out.
Ms. Akiwawo, do you have any thoughts about the last points in particular that Dr. Castell was talking about the role of community leaders and so on, and especially in the online environment?
Yeah, the last sentence or kind of recommendation is perfect, exactly what Glitch believes, and what I would want to echo, that digital citizenship is about rights and responsibility, and it's about making sure that our online communities are safe, are clean, are not toxic, and not reproducing the same inequalities, and are not being hijacked and weaponized against the very communities that it was meant to help increase the playing field. And to do that is understanding that we all have a role to play in being active bystanders and being digital citizens. And so that looks like reporting abuse that we see on the platform. It looks like countering fake news. It looks like being critical before sharing information. But it also, and what I really would like to see more of, to answer your question more directly, is tech accountability. I think really seeing and being able to equip everyday users to realize that they can hold the likes of Jack Dorsey, Mark Zuckerberg, and all that these tech companies that they use, they can hold them to account. We don't have to wait for something so bad and so significant to happen, whether it be another celebrity having to take their lives because they cannot take how horrendous the platform is, or a young person taking an awful diet pill, or somebody spreading fake news about a particular MP and then having to shut their offices because it's not safe for them and their staff. Like, let's not wait for it to get to this dire state before we hold tech companies to account. And this shouldn't negate the communities that have been doing it. For example, Zoom bombing. There've been communities for years who'd been talking about how the security settings on the platform were not up to scratch, and then we saw a massive use of it in March, April, and May, and then all of a sudden they chose to believe. But I do want us to start seeing the online space as our community. Yes, we have to pick the litter up when we see it sometimes, and yes, we have to play our part in shaping it and molding it and setting the culture and standards we want to see. But also, we have a right to be calling for long-term systematic change. We have a right, the same way that we call on our MPs, our politicians, our lawmakers to act. We also can ask that of these tech companies. They do have a duty of care to all of their users, not just their shareholders.
You've touched on quite a bit here, right? That is very near and dear to our Institute's heart, and to the themes for today's conference. But your charity you actually do a great deal of training with individuals to teach them how to be better citizens. You focus on the communities themselves. You've created a number of steps and guides that people can follow. Obviously today we can't each all go through this specific training, but I wonder if you might take a few minutes to give the members of our audience a sort of abbreviated version of this, to share some of the tips and tricks that you recommend to people, either when they're experiencing online abuse and harassment themselves, or when they're witnessing it, how they might support other people.
Thank you, because it's a great plug, because we've launched the new series of our workshops today, autumn winter program workshops, which are free for anybody just to sign up, so you can come along to one of those. But my top tips, if you are somebody facing online abuse or harassment, my first tip is let somebody know, because the whole kind of DNA of violence is to isolate you, is to make you feel really vulnerable, and that's where a lot more things start to kick off. So let somebody know, and when you're letting them know, try and articulate what is the support you need from them. You're letting your employer know because you need time off, or you're letting your friend know because you need them to support you online, but being really clear about what is it you need from them. The second thing is documenting it, because yes, it's important to report and to block and to mute and to do all of those things, but documenting is so important, because actually it might help paint a picture. It might help start finding some patterns. Quick lived experience. Before the abuse happened to me, when the video went viral, I actually was hacked, but I never put the two together until I set up Glitcher, was doing this training, and realized, oh, they did try to get me before. So documenting abuse is really important, particularly if you're somebody that's in politics, you're working from a particular organization or institution, and you've just released a report. You might find that actually it's one troll trolling all the women in your department, all the people of color in your department. So documenting it is really important. We have a free documentation, how to document abuse resource on our website. And then my third tip would be, how do I pick? My third tip would be digital self-care. I think particularly for women who have been conditioned and grown up to put themselves last, not even second, to put themselves last, don't sometimes feel able to have agency and set boundaries online, and always feel guilty around blocking or muting or filtering. And actually digital self-care is so important, and particularly if we're going to enter another lockdown. So that looks like muting a particular account, muting particular keywords. You could even do it on weekends, so that, you know, if you don't want to see, for example, me don't want to always see online abuse on the weekend when I just want to be on social media looking at the beautiful Idris Elba, I mute the words online abuse. I don't have to be seeing that online and then feel like I have to respond and then be at work on a Saturday and a Sunday. So really looking at how, and this is something I hope to explore with my fellowship at IGPP, looking at ways that we can increase digital citizenship and our agency online. And then if you are seeing somebody facing online abuse and you're not sure what to do, number one, reach out and ask them, because going back to the first point I made, if you're a victim of online abuse, that you are isolated, letting them know that you've seen the violence and actually affirming to them that it is violence is really helpful, because sometimes, particularly women, we gaslight ourselves. We play it down and we're like, oh, maybe I'm over exaggerating and being sensitive. Actually, somebody saying, I've seen what's happened to you and it's not okay, gives you that kind of confidence to be like, yeah, it's not okay and I want to do something about it. Help report it. And sometimes people think when we talk about digital citizenship or about ending online abuse that we're all about everyone's going to get along online and everyone's going to love each other and everyone's going to vote one way. Like, that's not what it's about. It's about how we critically engage in topics without having it to descend to online abuse, but also at the same time not seeking to always be liked and adored online. And that, I think, being able to show that we can, or role model that Rebecca, you made a really interesting point on Twitter, and it made me think, I don't necessarily agree, but it made me think, thank you, is just ways that we can model civil disagreement. And I feel like we've lost the art of online debate. And if we're going to be having more conversations, particularly here in the UK and Europe with Brexit and Gender Recognition Act, and obviously with the election coming up in two weeks' time, and then the aftermath of that, we're going to be having much bigger geopolitics conversation online, then we have to start understanding how we can respectfully disagree online as digital citizens.
So, Dr. Castell, a lot of what Ms. Akiwowo has just described and the sort of tips and even the language that she's used seems to me, as an outside observer, to actually fit fairly well with a kind of public health frame. And I wonder if you have any thoughts about how we might think about our online selves and our online interactions from that public health perspective.
Yeah, no, I mean, a lot of that resonates with the public health, face of this. Thinking about in the context of the pandemic, I was thinking, what is everyone's role, right? So whether you're a student and you are trying to help other students understand, what's happening with the pandemic, whether you're a community leader, whether you're a politician, whether you're just an everyday citizen, my take on this response to the pandemic has been that everyone has played a role, even just staying at home and reinforcing that, look, everyone, I'm posting on Facebook, I'm learning how to cook a healthy meal, or I'm doing self-care by exercising, in my backyard or my basement or wherever it may be. All of those things are really important, that you are reinforcing a message. You're saying, okay, I'm playing a part in this response by doing what's being asked of me, which is to, remain at home, to be socially distant, but still thinking about your own emotional well-being, your own physical well-being. And so again, I think it just shows that everyone has to play a role here. And that this is really about health. And, even the negative, the disinformation, the bullying that happens online, that's all health related, right? And so it's really important that we think about these as public health issues that need to be addressed more broadly than just focusing on, oh, that poor individual, that that one person was cyberbullied, for example. This is really something that has to a response that has to happen at a community level.
The very last question before we wrap up, I'd like to put to both of you in turn. Starting with Ms. Akiwowo, you talked, at least in general terms, about the role of the platforms themselves. Right? You referenced Jack Dorsey, the head of Twitter, and Mark Zuckerberg, the head of Facebook. If you could turn to them, if you had these two corporate leaders as well as others from the social media companies sitting in front of you right now, socially distanced, of course, but sitting in front of you right now, what would you say to them? What would you ask for them to do or focus on?
Oh, you're asking a tough question there. Right now, what I would ask for them to do is to allocate some money, allocate some funding, give up some of the profits. They're a multi-billion-dollar company. Give up some money to work around online gender-based violence from an intersectional and health perspective. Pay civil society groups that are basically working for free or not enough, that is helping make their platforms be safer and do well so they can keep their profit margins healthy. You let that money be used for proper educational interventions. A lot of the time in our workshops go to teaching people how to use the platform safely. That should be something that these companies should be paying for. I think we need them to part with money for them to care about how their money is being spent and the return of investment, because that seems to be the only way that companies understand or care. And I think when you have a good chunk of money and resources, then you can push for long-term systematic change. Because something where I completely agree with Dr. Amanda is these little, and they're very important obviously, but these little micro repercussions of the platform are being dealt with. So we're dealing with piecemeals, we're dealing with one incident here and there that gets to be high profile, but what we're not seeing is systematic long-term change. We're not seeing policy changes, transparency and reform. And so that allocation of budget would really be the thing that would be pushing for long-term change. So yeah, I would say cough up some coins.
All right, so after putting you on the hot seat first, I'm now going to turn to Dr. Castell for our final word. What in particular would you like to see the tech, the platforms, these companies themselves doing to help people like yourself, the on-the-ground public health workers?
Yes, so I would like to take those coins that Zayi was talking about. I would want them to take those coins and to really develop a committee or a task force, okay? So it could be a public health task force that is made up of experts and community members, right? Not just the scientists, but the community members, and of course, a broad range of individuals in terms of age, race, ethnicity, native English speakers, maybe non-native English speakers, because everyone is using these platforms. So I would want them to create a very comprehensive task force that's representative of the different opinions and the different perspectives to try to really be proactive instead of reactive. So to think about what are the positive messages that can come out. And maybe that's working with individuals from local and state health departments. Maybe it's working with individuals from the CDC. Maybe it's working with researchers from academic institutions, but really thinking about how we can best message information so that people get accurate information and that we can try to prevent, right, these issues that we're facing now. So whether it's around, the response to COVID, maybe, they have Dr. Fauci as one of their leading people that they engage in this. I mean, he has been obviously a solid and reliable voice during this pandemic. But finding those individuals, as I mentioned before, those key opinion leaders that can really help us to get information out in the best way that's going to be receptive or received well by a variety of communities, I think would be most important.
Well, I want to say thank you. I'm so grateful to both Dr. Amanda Castell and Seyi Akiwowo for joining us today, and of course to Dr. Lena Wen for joining us earlier in the week to engage in discussion on such an important, timely topic. I also want to thank those in the audience who have joined us. In a few minutes, we're going to turn to another incredibly timely discussion about the looming threat of post-election violence and how it's being organized online. The experts that we've gathered are going to share their perspectives, their insights about a variety of groups and plans that are really currently taking shape as we speak online. So please stay with us for that conversation. But first, I'd like to turn your attention to IDDP's founding director, Steve Livingston, for a few thoughts about today's event.
Hello, I'm Stephen Livingston, Professor of Media and Public Affairs and the founding director of the Institute for Data, Democracy, and Politics. Welcome to this conference on COVID-19 and digital politics. In 2016, when I began working on what would last year become IDDP, I was motivated by two core concerns. First, I knew the threats to democracy posed by malicious actors on social media platforms were too big and too complex for any single academic discipline to tackle on its own. Social scientists, area specialists, computer and data scientists all needed to work together as a team. I also knew that with different vocabularies, different methods, and professional expectations, cross-disciplinary work would be hard. Yet with time, I also knew that we would discover common passions and that we would have so much to learn from one another. Secondly, I believe that scholars must share their work with the public. Our research must not remain siloed in academic papers and in discussions amongst a handful of experts. In short, I wanted to bring together bright people in common cause to benefit others. I am very proud to say that today's forum reflects these convictions. So far, we've learned about the challenges associated with fact-checking online campaigns and events. We've also learned about the impact of pandemic-related disinformation on marginalized communities. Our next two panels will discuss potential post-election violence and the pandemic's influence on political discourse. I'm so pleased you have decided to join us. I'm sure you will find the next two panels interesting and informative. Thank you very much.